Let me introduce myself. I'm Arnot Banerjee. I'm the Chief Quality and Innovation Officer for our healthcare system in upstate New York. Have been in this field for over 16 years now. And my background is industrial engineering, began with that in healthcare engineering, ended up in healthcare management, starting with quality and product process improvement, and then finally finished my doctorate in chronic disease management. So I think I had a wide variety of degrees. I never stopped learning. People call me professional student because I never stopped going to school. But at the same time, I think I have learned a lot from healthcare, and certainly an industry where we all, no matter how much we know, we still continue to learn every day. So I think this conference, I'm honored to actually chair this conference for you guys. And what we are looking at here is care coordination, transition, and complex care management, well coordinated by World Congress. I think I give a lot of kudos to World Congress to coordinate this. So I think patient-centered models is a very key to every organization. I think we looked at it from a variety of angles. Everybody does care coordination in different ways, but how much we learn from each other is the key. There are quite a few topics, and we will listen to a lot of experts today about patient care coordination models. Looking at patient care coordinated models, if we ask anybody a question about what's care coordination, we all will say, well, the inpatient silo needs to talk to the outpatient silo, and the home care services and the post-acute care services, they all need to talk to each other. And I think that portion is very clear to us. And I believe that care coordination was known to us maybe 10 years ago. Everybody knew what care coordination was. Everybody knew what we needed to do, what we have to make sure so that we can focus on the patient-centered care coordination models. But we wanted to get to a point where we can use technology and make sure that mobile devices, smartphones nowadays are extremely key in patient care coordination models. So how do we utilize that? So that's where many companies actually started coming together. Hospitals started learning from their mistakes, readmissions, length of stay, repeat ED utilizers, and stuff like that. So I think we have learned a lot, but we still continue to improve and try to reduce cost. Moving from a volume-based care to a value-based care, we absolutely need this. We cannot function without having a good care coordination model. So I think this is the right topic to talk about. It is absolutely the right time to talk about it, considering that we will soon be going into an era of universal healthcare, nobody knows, or Medicare for all. And where do we end up with that? Whether it will be captive payments for 50% of your current insured payments, how does it actually function within hospital systems? So I think this is really key. So where does this care coordination actually help for people like us? Because I will talk from a perspective that where you are sitting from. So what would you take out of this conference today so that you can apply it back to your home ground? And I think that's the key part, that we all need to get involved and ask questions and discuss with each other. It is not a one-way conversation. When I chair a conference like this, I always want to make sure that the audience is actually involved in the presentation rather than a presenter just presenting a topic and leaving. I think that is not helpful. And we have been to many conferences, I'm sure you guys have been to as well, where the presenter is presenting a topic, it's very interesting, I think for that 20 minutes or 30 minutes post-session. After that, it's very hard to actually apply that back to your hospital setting or healthcare ground where you are actually working on. So try to connect those two dots and see how you can connect the practice that is being seen here and then how you apply it there. One of the best examples that I could think of is MedRec. Anybody has problem with MedRec in their institution? Oh, God, yeah. The reason is that MedRec is one of the most common problems. Similar problem, ED throughput. Anybody has problem with ED throughput? We all do. It has been researched for more than 45 years. Have we found a solution yet? Has anybody said that our ED only take less than 60 minutes door to floor? Never happens. We have goals, but we were never able to prove it. So what's stopping us from actually doing it? It's because of that variation that we have. Every single practice within this room actually has a lot of variation itself. So we need to standardize it as best as we can. So that's a good example that I would like to recommend. Biggest part nowadays is big data. I'm sure you must have heard a lot about big data. When I look at the sponsors, the general sponsors outside, there's a lot of data talk. Everybody wants to know about data, everybody wants to collect data, make data, like integrate data, utilize data, but how successful we have been to actually use data and impact patients. That's the key thing. It's not just the care providers. We talk about the first victim, second victim, and third victim, right? So there was a book that was actually recently given to us by our CEO saying, patients come second. Anybody read that book, Patients Come Second? Highly recommend to read that book, Patients Come Second. So everybody asks that question, what's happening? Who comes first then? Employees. So if you take care of the employees, if you give them the right data at the right time, they might be able to provide better care to our patients. So I think data is good, but how to utilize data is actually the most valuable part. So we need to focus on that. During the course of the day and the day or two, I would say, so we talk about best practices, but I would highly recommend you guys to talk to each other. And that's where we will learn from best practices. I was awarded a Becker's Award in 2017, and the metrics that they had taken was from my quality balance scorecard. And I have a huge area to oversee on quality and patient safety, and my top 10 metrics were actually below 67% drop. And the biggest reason was that I didn't do all that stuff myself. It's not just the CDC best practice that will take you there. It's about how you network, how you talk to other hospitals, and how you bring that best practice and apply it. And that's where I think it's great to see that. So would we be, I ask this question every time, everybody knows that we have a credit score, right? Like 719, and you can have your credit score live, and if you take the next step, it will actually improve your score by 15. You have heard these stories. Have anybody heard about that in 2 years, 3 years from now, we are gonna be having a healthcare score? Would we be the inventors for the healthcare score where we would be actually marked on a bench saying, if your score is below this, then you're actually having a higher insurance premium. If your score is above this, then you will actually have access to different services. It's coming. So I think these are the questions that is going to arrive from care coordination models. I also want to talk about a little bit about artificial intelligence. We have talked about this, that we're not going to need doctors or nurses anymore. We can walk into a system and Alexa and Watson will talk to us and say that, we got you, John, and this is your problem, and this is what we're going to prescribe, and you're on your way, and here's how you want to do it. But it has been it's not implemented in real healthcare systems yet. So how do you utilize data, artificial intelligence, and the best practice that you have? How do you combine this and apply to care coordination? And I think that's where there's a lot of talks, and we will actually enjoy that. Again, I would like to thank World Congress to put this session together, Gina and her whole team, Brian, Betsy, and others. And I look forward to hear from all the expert speakers as well. I personally would like to thank you all to attend this conference.